So hello again. In this talk, I'm going to talk about mean versus voxel region analysis, registration and segmentation methods. So registration and segmentation methods are very important for the symmetry. And then I will summarize the main segmentation methods, and then I will discuss a bit about mean and voxel region analysis. So I'm currently a consultant for Imedica Pharma IB. In image registration of the SPECT and the CT image, this is an essential issue in the symmetry regarding mean and regarding voxel dosimetry for therapy with radionuclides in order to perform some corrections in the SPECT reconstruction, such as attenuation and scatter correction, to determine the mass distribution, which is needed to determine the absorbed doses, and also to propagate the volumes of interest if we want to perform that propagation. In the image registration of two images, one image is taken as the reference image, and the other image may need to be moved and rotated along the three axes. That's rigid registration. Or we could even deform the image, which would be the deformable registration. Deformable registration will be more complex than registration, but that doesn't mean that we are going to obtain better results. Sometimes, in some cases, we could use deformable registration for calculations, for instance, and rigid registration to segment volumes or to visualize the different images. Regarding activity quantification based on expect CT, we know that we need accurate registration in the CT and the SPECT images. We can check that with a phantom, but of course, we need that the patient don't move between the acquisitions. To perform dosimetry, we normally acquire a series of images to determine the time activity curve. So those images must be registered if we want to propagate volumes between the acquisitions. It would be desirable that patients are in the same position using motion restrainers, and we have to be careful also with the position of the arms. They must be in the same position all the time. And that way, registration of the different organs or the lesions will be easier. So usually, the first image in the series of images is taken as the reference to perform the registration. We could use the rigid or the deformable registration. Normally, we use the registration. We perform the registration in the CT images because the spatial resolution is much better, and we have more information in those images. And then we apply the parameters of the registration to the SPECT image. So once the registration is performed, we can propagate the segmented volumes. We could also segment the volumes in the different images, but we can save time if we just propagate them, and if we could also modify them in the different images. For instance, if we draw the kidneys, we could propagate those volumes of interest, and then normally they don't perfectly fit in the other images, but we can slightly modify them. We could also register different types of images, such as SPECT and PET, as in this case of a treatment with microspheres. So we need to segment a region to determine the activity. But as I said in the previous presentation, the spatial resolution in SPECT imaging is not as good as in the CT image. So it's not segmentation of what we see in the SPECT image doesn't mean that we are going to segment we are segmenting properly the volume. So this is quite a tricky issue in SPECT CT based dosimetry. Segmentation could be performed either in the SPECT image or in the CT image. Segmentation in the CT image is generally more straightforward than in SPECT images because of the worse spatial resolution in SPECT images. As I mentioned before, in the CT image, the spatial resolution is lower than 1 millimeter, but in the SPECT images, it is greater than 1 centimeter. If we perform segmentation in CT images, we could just delineate or render the external surface of the organ of the lesions. But this segmentation in the CT images is normally performed for the organs which are clearly visible in the CT image. It could be applied also to lesions, but they are not normally visible in the CT image. So we would use contrast enhanced CT, but this is not always possible. So those lesions are normally segmented in SPECT images because we can see in the SPECT images we can see the functional parts of the lesions and of the organs, and this way we can segment the lesions. But again, we have to be careful that with what delineate, because it could not be the real volume. So there are different techniques to segment organs or lesions or volumes in SPECT images. Also in the case of the CT images. In the case of CT images, we could always, because what we have such a good spatial resolution, we can delineate the organs manually, but that takes lots of time. So we can use other kinds of other techniques to delineate the organs. So I will summarize the main techniques used to delineate organs or lesions in SPECT or in CT images, but of course there are other techniques in the literature. The most simple methods are the fixed threshold methods. In this way, we would just use a threshold, for instance, of 42% or 40% to delineate the volume of, in this case, the volume of the sphere. But we have to adapt this threshold value to our gamma camera with some measurements of the spheres. I mean, not in all cases the 40%, the value of the 40% will be valid. We could also use adaptive threshold methods. In this case, threshold is chosen to classify a set of voxels either as an object or as background. As we can see here on the left-hand side, we have the image, and on the right-hand side, we have the delineated, the segmented image. Then we have iterative threshold methods. In this case, the source to background ratio is calculated for different boundaries, and then this is done until a predefined difference is reached. In this case, we can see that there are different thresholds for activity determination or volume determination because of the partial volume effect. We go now for more complicated methods, which are the boundary-based methods. In this case, we could use the Fourier surface method, in which Fourier descriptors are determined for a given number of Fourier orders, such that the resulting surface follows the object contour. In this case, we need quite solid mathematical knowledge to perform these methods. And also for gradient methods, in which the surface is obtained calculating gradient vector for each voxel, and the points where the gradient is the largest in magnitude would correspond to the object contour. But again, we need solid mathematical knowledge for this. And there are also AI methods. Here we can see an example, and well, they are normally implemented in commercial programs, and they save us quite a lot of time. So these are the main methods, and now I will give some examples of segmentation, a comparison between different methods. Normally, the more complex method will give us the better result, but this is not necessarily true in all cases. And we must always, it's always advisable to use different approaches and perform a comparison of the approaches and check what approach is better. Here we can see a comparison of manual delineation and AI delineation. They are quite similar, but they are not the same, and we should check which one gives us better results. Here we can see an example of a segmentation with the O2 method, in which we obtain two classes of voxels, those belonging to the region and those in the background. Here we can see a nice paper on segmentation in spec imaging with three methods: the fixed threshold method, the O2 method, and the Fourier surface base method. We can see that for 3 volumes we obtain 3 different results. And again, we have to be careful because not always the most complicated, the more complex method will give us the better result. We always have to check it. So those were the main segmentation methods, and so depending on what we are interested in, we have to study what method suits us better. So now I will go with mean versus voxel image analysis. In external beam radiotherapy, we know that the use of those volume histograms is common, but that's not the case in molecular radiotherapy, because in the case of the smaller volumes, we are going to have quite a bad recovery of the activity and quite a large partial volume effect. So we can obtain, of course, those volume histograms, but they are not going to be realistic because we are going to have voxels with activity, but in reality, in that tissue, there is no activity. So we must be careful about that. Here we can see a nice example of how we can perform very complicated Monte Carlo calculations, but the results are going to be far from the real distribution of activity or the distribution of absorbed dose. In this case, it's a dashed line represents the real distribution, and we can see that as the volume decreases, the calculated distributions are going to be more different from than the real distribution. So even if we perform a very good calculation because of the partial volume effect, we are going to be quite wrong dose volume histograms. Here we can see another example. This is a kidney with the activity in the cortex 5 times higher than in the medulla. And we can see that even if we perform a very large number of iterations and we perform a partial volume correction, our activity distribution at voxel level is going to differ from the real distribution. So we get closer as we improve our reconstruction, but still with the current methods, it's quite complicated to get. It's impossible. We are not going to obtain the real distribution. So as the last point, we know that in the case of molecular radiotherapy, we don't only acquire one image. We acquire 3 images to determine the time integrated activities. So that makes even more complicated to obtain accurate dose volume histograms of the absorbed dose. We can obtain the histograms for the activity for each of the images, but then we have to obtain the absorbed dose. And if we want to obtain the dose volume histograms, we need to calculate effective half-lives for each of the voxels. And if the registration, if image registration is not quite good, we could even obtain negative effective half-lives. So a compromise could be to use the effective half-life for the mean effective half-life of all the volume for all the voxels in the first image, and that way we will obtain those volume histogram, but not with the effective half-lives of all the voxels. In this example, they obtain very nice curves for all the voxels with positive effective half-lives. So that means that the registration is quite good. But of course, this is a study performed by people with a great expertise. So this is not that easy. So as a first approximation, as I mentioned, we could just use the effective half-life of the mean volume. So in summary, I would say that, of course, it is always possible to obtain a dose volume histogram, but we have to be careful about the interpretation of that those volume histograms, because we could have voxels with activity in which in reality there is no activity. So always be careful about that. So thank you very much for your attention.